Atrial fibrillation is a common heart condition that affects approximately 2.5 million Americans every year. Atrial fibrillation requires immediate medical attention. If not treated, it can lead to life-threatening strokes. The treatment of atrial fibrillation may require long-term medication and possibly electroshock to the heart. This patient education module will discuss the symptoms and treatment options for atrial fibrillation. Anatomy. The heart is the most important muscle in the body. It is formed by two sides, the right side and the left side. Each side has two chambers, an atrium and a larger ventricle. Blood comes from the body to the right atrium. From there, it is pumped to the right ventricle. The right ventricle pumps the blood to the lungs. In the lungs, oxygen is delivered to the blood. From the lungs, blood goes to the left atrium and then to the left ventricle. From there, it is pumped to the rest of the body. Heart contractions are synchronized. A normal heart rate varies between 60 and 100 beats per minute while a person is at rest. The muscles of the heart contract and pump blood because they are stimulated by a small electric current. The electric current in the heart starts in the area of the atria known as the sinus node. It causes the atria to contract and pump blood to the ventricles. From the sinus node, the electric current travels through fibers similar to electric cables to another area of the ventricles known as the atrioventricular node, or AV node. From the AV node, the electric current goes to the ventricles and causes them to contract and pump blood. Atrial fibrillation. Atrial fibrillation occurs when the electric current in the heart is generated from all over the atria at a very high speed, between 300 and 500 impulses a minute. This does not allow the atria to contract in a synchronized fashion. Because of the high number of impulses generated by the heart and their location, the atria begin to quiver. This is known in medical terms as fibrillation. When this happens, the ventricles contract independently from the atria. This causes a fast, irregular heart rate between 80 and 160 beats per minute. Such a rapid and irregular heart rate causes some blood to remain in the heart after every contraction. This results in blood pooling in the heart chambers, which increases the risk of blood clot formation. These blood clots can get dislodged and travel to the brain and lungs, where they could block the flow of blood. When the flow of blood is interrupted, a fatal or disabling stroke could occur. Causes. Coronary artery disease and heart failure are the two main causes of atrial fibrillation.